Sure. Well, thanks, Cliff. I think it is interesting, as Dr. Hudas mentioned, to go back a few decades and realize how much we've learned and how much our view of breast cancer has changed since that time. It was actually back in the mid-1970s that I first became interested in doing research on breast cancer. And about that time, it was starting to be appreciated, and the data were really very clear that there were huge differences in breast cancer rates if you looked at various countries around the world, such as Japan or South America. Traditional societies in Africa as well had very low rates of breast cancer, about 1/8 of those in the United States. And that obviously raised the question, why? And until that time, it had really hardly been even in our thinking that breast cancer might be potentially preventable. And I should say that applies to a lot of other cancers as well. So if there were such huge differences in rates, and then we saw that people coming to live in the United States after a couple of generations went from those very low risks to the high risks that we have here, there had to be something about our environment or diet and lifestyle that was important. So my colleagues and I set up several large studies, the Nurses' Health Study 1 and 2 that you may have heard of. These are about 230,000 women, all registered nurses from around the United States, who have been providing data in detail on their diet and lifestyle since 1980. We've also collected blood, DNA, urine, toenail clippings with trace elements, pretty much everything you can imagine to try to put together the most complete picture of various factors that might influence their risk of breast cancer and other health consequences as well. And the Breast Cancer Research Foundation support has really been extremely instrumental in helping us continue these large studies. Inevitably, you've probably been hearing NIH is giving funding gaps now, and the foundation really helped us bridge those. Also, the foundation helped us enroll about 16,000 daughters of the Nurses' Health Study 2 to be able to look at diet and lifestyle factors in adolescents, and that's providing some important leads now. I don't have time to go into all of the things that we've learned, but I'll just mention very briefly for breast cancer specifically. In the beginning, when we started, there had been the belief that dietary fat might be the most important factor in determining breast cancer. And it's with the findings from our study and now other studies as well, it's pretty clear that if there is any effect of dietary fat in midlife or later on breast cancer risk, it's very small. We don't really find any hint at all that higher fat intake increases breast cancer risk at least during midlife and later. And as I mentioned, we're starting to look at children. Now, the type of fat's very important for heart disease and diabetes prevention, so we could talk about that. So what you eat is tremendously important, but for breast cancer, fat in the diet, which had been the primary belief, does not turn out to be a major factor. On the other hand, fat in the body has turned out to be very important, and that midlife weight gain is the strongest and most clear risk factor for breast cancer, for postmenopausal breast cancer that we've seen. Another factor that was controversial when we first published the data was alcohol consumption. And it is very clear now, I think no one doubts that there is an increase in risk of breast cancer with alcohol consumption. And our latest data, not yet published, we can even detect a small but significant increase down at about 1 drink every other day. That sounds a little troublesome, but because most of us like to enjoy some. And the good finding is that we have seen that if women get enough folic acid just by taking a multiple vitamin, that seems to mitigate most of the excess risk from the alcohol consumption. So we're updating the information on that too, just to be sure that that holds with the longer follow-up. When we've started to look in the earlier years, which seem to be important now, it does teach us how complicated breast cancer is, though, because what we're finding now is that if we look in childhood, the girls who were overweight actually have a 50% lower risk of breast cancer during the premenopausal years. And it's just enough to keep us humble. And when we start to think we understand things, that breast cancer tells us that life and disease is very complicated. So with the help of the Breast Cancer Research Foundation, we're working to try to understand that better. And there are a few leads, we can talk about them later. But that's a quick snapshot of the kind of work that we're doing. And we've, I think, made a lot of progress in some areas, but there's clearly much more work to do with understanding how to best prevent breast cancer. And again, your support has been tremendously appreciated and gone a long way to help make this progress possible.
So Walter, you haven't proposed folate in beer, huh?
Well, no, we haven't. Although I was interested that one of my colleagues is trying to get a law passed in California that on the wine shelves in the liquor stores they have sell multiple vitamins also. So that's an alternative.
So drink away, just take your multivitamin. All right.